Welcome back. We are now going to consider the effects of burnout on the individual who's suffering with burnout. We've discussed about workload, the work demand imbalance, the fast pace at work, the organizational modifications that can be done is completely out of the remit of this particular course. Again, we will consider in greater detail in the 6-week course. The lack of control and feeling boxed or feeling trapped. Optimization can be done. Time management is a learnable skill. You can plan. Autonomy can be available in a controlled fashion. And continued education and coaching is extremely important. A stressor in the frontline work is unavoidable. A stressor does not need to be transferred into stress. Learnable skill, you can learn about it, you can educate yourself about it. The demand and resource can be balanced. Modifications in the institutional level with the pathways at work, with modification of EMRs, electronic medical records, can be a fantastic manipulation at work to create a win-win type of situation. Lack of meaning or lack of control will not happen because burnout has massive consequences. And the consequences that we're going to talk about to begin with, cognitive. The judgment errors are extremely important to understand, because if you can't judge what is happening, if you can't take important decisions, if you can't analyze the situation, if you can't triage the situation properly, if you can't keep your emotional cool properly, it's going to be very difficult. And that's what is noted in burnt out individuals. They start to make judgment errors, resulting in treatment errors, and they need to be taken into account. If you can't analyze something, you can't prevent that particular problem. So if you can't see a complication coming, you can't prevent it. And that's just basically because of the chaos that is happening due to interrupted life or situations in your organization, which can be changed. Okay? Approach your line managers or approach the hospital seniors, and majority of the time, particularly now that the knowledge about burnout is so common, there will be people who will help you. The physical consequences. A burnt out individual will not be able to look after his or her health. And there are significant consequences which we'll come to know in a second. And finally, what happens is your well-being will be affected. Psychologically. Burnout, we consider that in the stages of burnout. Burnout, chronic burnout, depression, clinical deep depression, causing suicidal ideation. We considered the amount of people who have suicidal ideation, the amount of frontline workers who attempt suicide, and we also know that 1 doctor per day is dying. The other statistic is not very common, and I hope it is not as staggeringly bad as what it appears. 1 doctor a day, 300 to 400 doctors a year are dying because of suicide. Not good, not good. Needs to be changed and can be stopped. Lack of relaxation or interruption of the stress, the stressor stress mechanism is very much possible. It's again a learned skill, and it is available through our courses or coaching means. If an individual continues to remain stressed, the consequences are significant. Accidents, so a chaotic journey in the morning or in the afternoon or evening when you kind of to and froing, road traffic accidents are fairly common. Medication errors, not looking after one's health and diet, causing obesity, diabetes, cardiovascular issues, depression, taking on chemicals to get a release mechanism, all are common, can be avoided. Spiritual consequences. The higher meaning is lost. If you have defined higher meaning, again, I've met so many individuals, so many doctors, or healthcare workers, or entrepreneurs, or teachers, or firefighters, or policemen. Why are we doing what we are doing? Have we defined our values? It is not philosophical. I don't think it is philosophical. If you define why you're doing what you're doing, and if you define your values and identify your needs, life becomes very easy. Okay, and we, through our courses as well as coaching, we will help you define all of that. And we've got 5 very different modalities wherein you will know about who you are, so that you can define what your values are and you can simplify your life. We are in 2020 and all of this hard work has been done. Why don't we utilize it? Why don't we use it? The higher values are extremely important to define so that we can work towards our fulfillment. There's significant amount of evidence of medical errors. Professional reputation becomes impaired. Patient outcomes. They're extremely important. I think what we do is for our patients, and I think as a clinician, I think if we were to understand that, I think half the job is done. We are doing this job for the patients. Of course, we're doing it for our fulfillment, but I'm not doing an orthopedic I'm not doing a knee replacement because I want to do a knee replacement. No, I'm doing it because the patient needs it. If the patient doesn't need it, the circumstances are not right. No, it is not the right option for the patient. And if that ethos was there, that we qualify whatever we do for the patient so that the outcome for the patient, if a patient wants to get rid of the pain and everything else has been tried and tested and nothing is working, and the only evidence-based circumstantial option available now is knee replacement, that's absolutely fine. I'm just giving you an example of knee replacement because that's what I do. Then that's fine. But if somebody who comes up and nothing has been tried or hasn't been tried and the patient is offered a knee replacement, no, that's not right. The outcome is not going to be very good, and that causes complications, and that causes unhappiness, and that causes animosity, and that causes litigation, and that causes stress levels and chronic stress and burnout. Staff turnover increases. If individuals are not happy at work, they leave work. There are people who leave medicine. These are consequences at work. We talked about depression, suicide, common. Near misses, extremely common. When we talk about suicidal ideation, it's only 20% of people who have suicidal ideation do seek help. And 9% of them will self-prescribe. They won't go and ask for help. The incidence of suicide is well known. About 12% of males and 20% of females. 300 to 400 doctors are dying on a daily basis. Now, through a survey, the results suggest that about 6.5% of physicians think about suicide. 34% have ideation. 25% have planned it. 70% of them, of the population who think about and have ideation, have attempted suicide. And they still don't seek help. Interesting, worrying. Happiness is defined. Pleasure can be planned. Meaning can be defined. It's a learnable skill. Engagement is required. Engagement is required between the clinician, between the institution, between the home environment. Lack of engagement leads to chaos. Achievements can only be made when there is communication between all the stakeholders. Substance abuse. 15% of healthcare workers have medication problems. Medication is not the right word. Abuse of substance is a problem. Debt is an important aspect that needs to be thought about. There is a wider assumption that healthcare workers, particularly physicians, are loaded. That needs to be thought about. It's not always the case. They will have relationship issues. They are fantastically educated. They bring home the medical knowledge and apply that into their home environments. It doesn't work. It just does not work. If we don't have life skills, we cannot bring the medical knowledge at home and apply it and expect a good result. If we don't integrate at work, things are going to be chaotic. Incidence of this in females is twice as likely. Substance abuse. The incidence of substance abuse is higher in medical professionals as compared to the average population. It's not only smoking, tobacco or alcohol abuse, the recreational drugs usage is quite common as well, particularly because physicians have access to it. And certainly because of this, the licensure and the reputation comes into stake, and errors start happening, and is the reason why personally as physicians need to be worried about, and at the same time that is the reason why, and rightfully so, institutions take it very seriously. So it is a partnership between the institution and the individual healthcare practitioner, and help is available. You don't ask for it, you don't get it. Help is available. Ask for help, and of course if help was not coming, that's a different story, but help is available. Rehab, if somebody was to suffer with substance abuse issues. And safe return to work is very, very likely, very, very likely. There is literature to suggest that once you identify issues and address them, that's when the cycle, if you like, becomes complete, and you can start getting the results out. So the next video is on diagnosis of burnout. I'll see you there.